Now, I don't have young children, as you might guess. Mine are older children who seem to want bank of dad. So I think my theme of this evening is more about money and cash and how we save money for the NHS. Thank you for the introduction. I'm going to talk to you about how digital products can save healthcare from disaster. I think everybody in this room has interaction with healthcare. Everyone probably has used a GP in the UK. I know some of you aren't from the UK but are aware of the NHS system. And I'm going to use the NHS system as the exemplar of what we're doing, but this system does travel to other places. So, as Anthony said, we have a company that I was running which actually does deliver healthcare, and therefore we really started to understand the problems of healthcare, which boil down to the fact that there aren't enough doctors and nurses around, and as people live longer, they need more time with their doctor, and therefore we've got an increasing problem of too much demand and not enough supply. So that's really what we wanted digital to help us solve. And let me just show you a quick video.
Leaders have said is not even close to what is required.
I think many of you will have heard about the view that there is a 20 billion shortfall between the money that's required to fund the NHS and what the government are going to fund. I mean, actually there's been some more discussions on that subsequently, but it's not just a problem of cash, it's also a problem of skills and how we solve that problem. And therefore I want to take you through our story of how we want to try and address that, particularly in primary care initially. So if you look at a GP practice today, which you probably don't use that often, but you may know, it's difficult to get an appointment, GPs are stressed and under pressure, less and less do young people want to go in and become a GP, they want to go into secondary care, so we're getting a bigger problem. I was talking to my parents the weekend, they never see the same doctor, so therefore their continuity of care has got worse, and therefore they're always starting their story again with a new doctor. There's also the other way around. There are a lot of appointments which are unnecessary. There was a study done interviewing doctors, and they reckon between 30 and 50% of the appointments that they had that weren't even necessary, didn't even need to see anybody. So then there's also a small proportion of people take up a lot of the appointments. So those are the problems which you probably can relate to or understand. Could we imagine some solutions to those problems? Now, what I'm going to talk to you about is digital solutions, but I'm sure many of you realise, there needs to be process change, there needs to be system change. I'm just going to focus on the technology, but I don't underestimate there needs to be system change and training if we're going to do that. We can't put a new digital system in for a GP without training them to understand how they can use that system. But I'm not going to talk about that because we just don't have the time. But we certainly should help patients to manage their condition more. The big buzzword around the world in healthcare at the moment is patient activation. How do we get patients much more engaged and activated in their healthcare? How do they realise what their problem is and how it could be impacted? So a really important thing which we've been working with, I say YLD, I always think it must make us proud, but I believe that is how do we get really good consumer engagement? Because although this for us is selling to a business, it's selling to the NHS or a GP practice, it is much more about getting the engagement of people using the system and then them being really activated in their healthcare. We also want to use the wider health community. People tend to focus in on GPs, but there's a lot better and wider community health services. Let's use, we talked about how we're going to use video for animals. Well, there's also, we can use chat and video for patient care in the NHS. that helps us to solve a number of problems. If I've got a GP available in Scotland, then I can use that GP in Scotland on video, but I can't use them if I'm going to force to do a face-to-face. So lots of things we could do by using these sorts of digital solutions. But the NHS has been around 70 years, and in that 70 years, I'd say there's been very little change in the way certainly GP practices have been delivered. We still ring up at 10 to 9 in the morning, wait for a queue on the phone, and eventually get an appointment with a GP. It has changed very little, and that's probably very similar to other industries in the sense that corner shops haven't changed because they don't have the investment, but big banking's changed, travel's changed, retail's changed. Where there's money to be invested, then there has been a change. But why hasn't healthcare changed? And if you go to the App Store, or if you go to any of the places which talk about health apps, or you read about digital health is massive, but it's extremely underutilized. Lots of digital health apps are really struggling because people aren't using them. So what did we see as the answer? We don't see the answer as being focusing on point solutions, saying, let's have a weight loss app and hope it goes okay, let's have a smoking cessation app, let's have a diabetes app. That isn't the way to get to patients. What we think is you've got to get the most common transaction. You've got to get people engaged. What's the thing that people do the most? Well, there are 300 million GP appointments per year. There are 700 million prescriptions issued every year. Now that seems to me, that's high volume, that's something that we can do something about. And then there are 300 million appointments. On average, everybody has about 5 appointments a year, so with a population of 60 million, there are 300 appointments. So we think that we ought to get the most common transactions onto the system first of all. So our app and our website, the first thing it's going to do is you're going to put your symptoms in, and it's going to give you an indication of a diagnosis to some extent. So it's going to say the conclusion we have to your symptoms is you've got the flu, or you've got conjunctivitis, or whatever. So we're helping people to assess their symptoms. Then depending on the urgency of the situation, we're going to make an appointment for you in the most appropriate place. If that's in the GP practice, then you'll get an appointment with the GP practice. If it's that you need to go to A&E, then we'll send you down to A&E. So the first thing we're doing with our digital health platform is doing the most common things, not trying to start with a small cohort of patients who've got diabetes and trying to give them a solution. We're trying to get a platform across a big cohort of the whole nation. And then the thing has to be relevant to the patient. The patient has to enjoy the usage. To some extent we have a little bit of opportunity, because some GP practices that we put this into are actually forcing patients to use it. So they can change the gradient, and therefore, they can say, if you want an appointment, you have to use a symptom assessment, you have to use DoctorLink, the product. But some aren't, so it has to be a really good solution. And then there has to be real benefits for GP practices, because GP practices, in the end, will be paying for this. I mean, at the moment, the NHS have decided they want this type of product rolled out, and it is being rolled out massively, and actually the NHS are paying for it, not the GP practices. But someone's paying for it, and therefore there has to be economic benefit to the system. So how are we going to manage patient demand? Because that was, back to the original point, there is too much demand and not enough supply. So the first thing is, if we people put their symptoms in, we can actually diagnose that 20% of the conditions are self-managing. So if you've got conjunctivitis, if you've got the flu, you don't need to see a doctor. Doctor can't help you. So the system will tell you, you've got conjunctivitis, go to a pharmacy, get some eye drops, and that in 20% of those cases where we can be clear that it's a self-managing condition, then we avoid that demand. There is then, interestingly, in some cases, we can't be clear about 2 conditions. So we'll give information about one condition, and the first bit of information will say this condition is the most acute, and if you have that condition, then you should go to A&E. But you may have this other condition, which is, let's say, the flu, and that's a self-managing condition. And we find that another 15% of people look at those conclusion and say, well, actually, I don't have the condition that needs me to go to A&E, so I will actually self-manage, and therefore we get about 35% of people who've been through the symptom assessment actually self-manage. So, that's a big demand reduction on the GP practice. The next thing that we do is that we then, if you do need something, we reach what's called a disposition. So having got a conclusion, there's a disposition about what is it you need. Do you need a doctor within 4 hours? Do you need a pharmacist within 24 hours? Do you need a nurse? Do you need someone who can do a wound, stitch a wound? Because actually GP practice isn't ideal to stitch a wound. You might need a walk-in centre or something like that. So what the system then does is said, I'm going to look across all of the resources in your locality, and I'm going to take that disposition and find the best place for you to go within the time. So if you go onto the system at 6 o'clock at night and you urgently need a doctor, well, your doctor isn't open at 6 o'clock on a Friday night. So it will then find the nearest out-of-hours primary care centre, and it will book you into the out-of-hours primary care centre, because that is what's available at that particular time. So this is doing something, GP practice receptionists can't hold this directory of services in their head, so this is much more comprehensive and much more valuable than a GP practice receptionist, who actually shouldn't really be triaging you over the phone, and certainly can't hold a whole directory of services. So we've got algorithms that then work out where we send you. And then the final piece which really helps is, in a sense, very much like what Tom and Anthony have talked about, which is we think there are new channels of communication. Video is one. There's a lot of evidence that shows people prefer chat to video, but video as well will be important, because for certain things like, if you've got something wrong with your skin, then you might want to show that over the video. So all of those things are ways that we would see new channels of communication. So if you do need an appointment, or you do need to speak to someone urgently, we can probably do it more quickly and more easily through one of those means of communication. The next thing that we've done a lot of analysis of GP practices, and what was interesting to us, that roughly 50% of the appointments are driven by 10% of the people. We're saying 44% there, but it's overall, when you look at a range more, there's other appointments that people take up. And these people are not the ill people, they're the unhealthy people. And the biggest difference, we then analyse the difference between the 10% and the 50% and the 90%. 10% of the people have, on average, 13 appointments a year. 90% on average have 3 appointments a year. And the biggest difference between them is their BMI. So there is a whole group of people who have are heavier and are having mental health problems, diabetes problems, blood pressure problems, and we're not saying what the linkage is, but there is clearly something we need to do about changing people's behaviour in order to get them healthy, because that is where the demand is coming on the GPs. So we think we get to a total platform which has a number of components on it. First of all, we can do what's called a health risk assessment, where we can take a whole lot of information about somebody, and we can say, your chronological age might be 50, but your physical age is 55, and that's because you're smoking too much, drinking too much. Here's a well-being plan for you, which could bring your physical age back to your chronological age. So that's the first thing we do. We then have a symptom assessment, which is saying, well, at points in time, a bit like on the veterinary thing, at a point in time you're going to be ill. You are going to have something you're worried about, and therefore the platform is there for you to put your symptoms and work out whether that's something to be worried about, something you need to see a doctor about, or really is just something you could self-manage. It then, as I said, it has some algorithms which find the right service for you based on the conclusion and the disposition it came to. And then the next thing is, we then want to influence behaviour. We want to get to the 10% of people who are using the most demand on the service, and then we get into a full circle where we will analyse all of the data and be really clear about whether we're actually making any difference. Because if we don't make any difference, there's no point in doing it. So we think, from the evidence we're seeing at the moment, we're making a big difference to the practice who's got it in, and we're just about to roll it out to, well, our plan and the contracts we've got, we'll be rolling it out to about 900 GP practices between now and the end of June. So the great thing is the NHS have embraced this. Some of you have seen about Babylon. Babylon's a similar thing, although they have taken a very different approach to us. and they're not really heading into the NHS. The NHS have decided they're not very keen on them. But we're a similar type of service to Babylon, but we think safer technology, better technology, and certainly more embraced by the NHS. So, what do we think will happen in the future? We think it'll be easier to get an appointment, or you can read those things. We think there is a world where digital has transformed primary care and has transformed the cost of primary care and probably the cost of secondary care as well. It really can make a big difference, because what we're doing on this system is exactly what digital is really good at. It's really good at analysing problems. I mean, the symptom assessment, much better than a doctor in some ways. I'm not going to take the view that it's better than a doctor, but it never gets stressed. It can always ask lots of questions because it never gets impatient. So we do get a much more comprehensive assessment. And we found, what's interesting is, unlike other sort of experiences on the internet or on an app, people are quite happy answering lots of questions because they think, this is a very comprehensive assessment of my situation. And actually, if I need to see a doctor, all of that information goes to the doctor, and the doctor gets more information than they would have had if they'd just gone in and they had 10 minutes with you and they just asked a few cursory questions and guessed at what you got. So I think it's a very exciting future. A digital platform is going to change the way the NHS works, and hopefully it's coming to a practice near you shortly. So, thank you.